What if AI could do more than just answer questions? What if it could actually help you run your practice? Think about everything that's landed on your desk this week: patient messages, insurance paperwork, staff questions, onboarding documents, SOPs you've been meaning to update, and meeting notes you haven't organized yet. The work never stops. That's why Claude Cowork is getting so much attention right now. Claude Cowork isn't just a chatbot. It's an AI teammate that can actually execute work inside your practice. Hi, I'm Jamie, and I've spent the last 20 years helping private practices and med spas improve their operation. And when I saw this, I immediately started thinking, how can we use this in healthcare? In this video, I'm going to show you how Claude Cowork is different from ChatGPT and regular Claude, where I think it can help your practices save the most time and security boundaries you need to understand before you start using this. And if you'd like help identifying where AI can fit into your practice without creating compliance risks, there's a link in the description to schedule a call with me. Now, here's the problem. Most AI tools still create more work. Most physicians have already experimented with AI. You probably asked ChatGPT to write an email or summarize an article, or maybe to create some SOPs for you, which is awesome. But here's the problem. After AI gives you the answer, you're still doing work. You have to find the file, you have to upload it, you got to explain the content, copy the output, save it in the right folder, and then repeat the whole process the next time. AI answered your question, but it didn't reduce the number of steps in your workflow. That's where Claude Cowork is different. So let's talk about Claude Cowork versus ChatGPT. Here's the easiest way to think about this. ChatGPT answers your question. Claude Cowork does the work. Instead of compiling one prompt at a time, Claude Cowork can work across approved files and folders, remember your process, and handle multiple steps at one time. For example, instead of saying, create me a front desk SOP, you can say, review our existing onboarding documents, upload the front desk SOP to reflect the new scheduling process, save it in the operations folder, and create a summary of what's changed. That's the difference. It's not just generating content. It's helping manage the workflow around it. So here are 4 ways that I think healthcare can use this the most. Number 1, it works across all your files. Claude Cowork can work across approved folders and approved documents. So imagine asking, review our onboarding material and recommend updates. Or you can say, compare all the versions of our no-show policy and tell me what departments are using outdated information. Instead of searching through all your folders, Cowork will do it for you. Number 2, it remembers your systems. Most AI tools start from 0 every time. Claude Cowork includes something called skills, which allows it to learn how your practice likes things done. Your SOP format, your brand voice, your meeting summary template, your onboarding checklist. Teach it one time and every future task will follow the same thing. The consistency is where practices can save time. Now, if you're interested in using AI in your practice and you're not really sure where to start, we help practices identify the right tools, the right processes, and implement it safely. So if you'd like a customized roadmap for your practice, there's a link in the description to schedule a call with us. Okay, number 3, it handles multiple step tasks. This is where Claude Cowork really separates itself. Most AI tools complete one task at a time. Claude Cowork can complete a workflow. For example, review last month's staff meeting notes, update the action item tracker, and draft follow-up emails, and then create a summary for the leadership team. Or review our employee handbook, update the PTO policy, notify me of any conflicting documentation, and save the revised version. That work normally requires multiple tools, steps, and sometimes people. Okay, number 4, it works where your team works. The biggest time drain in most practices isn't the work itself. It's switching between your systems: emails, shared drive, spreadsheets, documents, project management tools. Claude Cowork is designed to reduce the friction by working across your systems your team already uses. So there's less searching, less copying and pasting, less content switching, and more time focusing on patient care. Now, this is all still very new, and healthcare needs to be very careful. But I believe that Claude Cowork represents the next phase, not just AI that simply answers the question, an AI that helps practices execute operational work. That's the big shift, because physicians don't need more information. They need help getting the work done. And the key is to figure out where these tools fit within your practice and where they don't. So if you want help using AI in your practice today with clear guardrails on what's safe and what isn't, I already made a video on exactly how to do that. I break down specific workflows, the tools, and the boundaries so you can implement AI without overwhelming your team or putting your practice at risk. That's going to be your next step, and I'll see you there.